Let me tell you a little bit about my background and how it relates to breast cancer and breast cancer reconstruction, as well as lymphedema surgery. I originally came from Rochester, New York, trained at the Johns Hopkins Hospital, where I learned all the advanced techniques in breast reconstruction. I worked at the Avon Breast Cancer Center up at Johns Hopkins. There, we did the most advanced microsurgery and other breast reconstruction techniques to help a woman after having a mastectomy. Not only do these surgeries provide the best and most quality results, but also they provide the least amount of problems after surgery. I did a study at the Johns Hopkins looking at these type of surgeries and found that women who had microvascular surgery for breast reconstruction were the most happy after surgery, not only with the results, but also with the way that the whole process went about. In terms of lymphedema surgery, this is kind of a newer surgery that's cutting edge. Women with lymphedema of not only the arms following breast cancer and breast cancer surgery, but also people who have lymphedema of the legs are able to now have therapies where lymph nodes are transferred via microvascular surgery from one area to another area of the body. By doing so, the new lymph channels are developed, helping to get rid of that extra fluid. Because this is such a cutting-edge technique, it's only offered in a few centers throughout the East Coast and the world. And I'm happy to be able to develop this in the Richmond area with a strong team of other microvascular surgeons, as well as a strong hospital team. And also to be able to offer this to individuals, not only in Richmond, but the world. And by doing so, I'm able to develop a good core team to help service these individuals. In terms of breast cancer reconstruction, this is an important part of my practice. And what I do specifically is something called microvascular surgery. It's where you take tissue from one area of the body, completely disconnect it from its blood supply, and then reconnect it to another area. By doing so, you're able to develop a breast for the woman after a mastectomy. The good thing about this surgery is that it's using your own tissue, that it's lifelong, it lasts forever. The other thing about this surgery is it has low morbidity in terms of the body. In the past, the traditional ways of using your own tissue for breast reconstruction involved muscle. But now I'm able to develop just the fat and the skin to be able to create a woman's breast, therefore avoiding the injury to the nerves, the muscles, and the body structures. These type of techniques are great because not only does it help recovery period, but it also helps the woman in terms of their strength and lower morbidity. So the reason that this is what I consider the gold standard of reconstruction today for most women is because it has such better results, not only in terms of looks, but also emotionally. Women do better, they have better satisfaction, but also because it has less problems and less morbidity in terms of the outcome.